Hi, everybody. Today's focus is going to be on the reproductive system lecture. We are going to go ahead and get started with looking at some of the general terminology associated with anatomy of the male and female reproductive system. So in case of the reproductive system, we have the primary sex organs, which generally referred to as the gonads. And in case of male, gonads are the testes that are responsible for production of a sperm. And in females, they are referred to as ovaries that are responsible for production of what we've identified as oocyte, which is basically the egg. The secondary function associated with gonads is production of the sex hormones. The main sex hormones for male, as many may know, is testosterone. In case of female, we have two main hormones, which is estrogen and progesterone. Now, in terms of the accessory sex organs, both gender have genitalia, and in case of male, we also include ducts and glands that are essential for the effective release of the semen from the male reproductive system. So we're now going to go ahead and get started with the male reproductive system. So the path for the sperm through the male reproductive system starts with the testes. So there are two testes, and we'll talk about the protection for the testes. These are located on the, one second, they are located outside the body. And right on top of the testes, you have this comma-shaped structure called the epididymis. Epididymis connects to this long tube that goes around the bladder and comes behind the bladder. This long tube carries the sperm out of the epididymis and toward the urethra for ejaculation. The tube is referred to as vas deferens or ductus deferens. It then passes through this tube, which you see right here, which is passing through the prostate gland by joining the fluid that is released from an accessory gland called seminal vesicle. And now this tube that is passing through the prostate gland is referred to as the ejaculatory duct. So ejaculatory duct joins the urethra that comes out of the bladder. So if this is the bladder, this long tube that you see coming out of the bladder, that's the urethra. So urethra is basically carries the sperm in terms of reproductive system and urine from the bladder in terms of urinary system out of the body. In terms of male, we also have three accessory glands. Again, we mentioned one already. The ones that are paired organs sitting in the inferior posterior of the bladder called the seminal vesicle. We have one gland that sits inferior to the bladder called the prostate gland. And we have talked about this previously in urinary system as well. And the third gland, which is not depicted here, would be sitting right here inferior to the prostate, connecting to the urethra, and is referred to as the bulbourethral gland. And again, we'll look at the function of each of these glands as we talk about the system as a whole. Here's another depiction. I really want to make sure that you guys are comfortable with identification of the structure as we go through the reproductive system. So we have the testes, the comma-shaped epididymis. Vas deferens in this picture, because it's a lateral cut, is not visible. But if it was, it would be coming out of your screen, then go around the bladder and comes back right here. When it passes and merges with the seminal vesicle tube, it forms this tube right here called the ejaculatory duct, and eventually empties into the urethra and excreted from the body. A few other things that you may notice here, again, is the prostate gland right below the bladder, seminal vesicle right behind it, and again, if you have the bulbourethral gland depicted here, it would be right here. I will show it to you on your future pictures. Posterior to the urinary bladder, we have the end of the digestive system, which is basically the rectum and the anal canal. And we also have the external genitalia for the male, which is basically the penis. Now let's go ahead and take a look at each of the organs in order and describe the function for the reproductive system. Let's start with the testes. So testes are the paired organs. Here is a depiction of one. You will notice that within the testes you have these coils upon coils of tubes, and these are referred to as the seminiferous tubules. And there's a cross section of the seminiferous tubules, and you can see clearly these little structures, and these little swimmers right here would be the sperm. So the organ that is responsible for production of the sperm is testes. But where in the testes that a sperm is produced is within the tubes called seminiferous tubules. Now, the second thing that we see in terms of the function of the testes is production of the hormone called testosterone. Now, what is the importance of testosterone? It has some functions. Actually, it has many functions in our body, not necessarily directly tied into the reproductive system, but some of these functions include deeper voice in males, larger muscles, body hair. We also have higher red blood cell count. Now, again, these are not the only one. It also testosterone also helps with production of the sperm. But again, if in most of these, what we identified as the function of testosterone, are not directly connected to the reproductive system, but they have overall changes in terms of the body. Now, after the testes produce the sperm, sperm moves from the seminiferous tubules. It actually gets collected by a sequence of ducts, which starts with the tube called rete testis, which are the branching you see right here. Rete testis continues to form these branches right here called the efferent ductules. And that eventually empties into this coma-shaped structure you see right here, which is the epididymis. So what is the function of epididymis? So in average, a sperm spends about 20 days inside the epididymis with the goal of learning how to swim and how to fertilize an egg. So it gains the proper enzyme that basically can break through the outer shells of the egg or the oocyte and be able to fertilize the egg effectively. Now, if the sperm is not ejaculated from the body, it can be stored for a while inside the epididymis. However, if that sperm is not used, shortly after, it does get degraded and the components basically broken down and recycled. Now, if the epididymis or if the male is starting the process of ejaculation, then the sperm moves from the epididymis through the tube which we identified as vas deferens or ductus deferens, which is the tube you see right here. Now, vas deferens or ductus deferens contain a smooth muscle on its wall with a goal of basically pushing the sperm up through the vas deferens around the bladder and eventually again gets to the inferior posterior aspect of the bladder. At that point, the vas deferens tube merges with the tube that is coming from the seminal vesicle or seminal gland, and it passes through a tiny tube within the prostate called the ejaculatory duct. So at that point, after merging with the seminal vesicle tubules, we don't call it vas deferens anymore. It changes the name as it passes through the prostate gland to ejaculatory duct. And as you can see or follow in the picture, ejaculatory duct becomes urea or merges with the urea as it continues to find its path out of the male reproductive system. Now, again, as we continue going through the reproductive system, here is a better depiction of the ejaculatory duct right here. Here is the bladder, and the tube that's coming off of the bladder is the urethra. So notice how the urethra is merging with the ejaculatory duct. So these two tubes are merging together within the prostate gland, and this part of the tube therefore receives the name prostatic urethra. Now, as it continues to come out of the prostate, it passes through this pink membrane you see right here. This membrane is called urogenital diaphragm. So as the urethra is passing through that specific region, so past the prostate, right after the prostate, as it's passing through that diaphragm, that part of the urethra is called membranous urethra. And the rest of the urethra basically goes through the length of the penis. So it is referred to as either penile urethra or a spongy urethra. The word spongy urethra will become clear as we talk about the erectile tissue of the penis in a few minutes. So if I ask you guys, write the path of a sperm through the male reproductive system, kind of putting it all in perspective, we can, and try to say it with me so you will remember that. It starts with the testes. Testes goes to the epididymis. Epididymis passes through the ductus deferens. Ductus deferens comes and merges with the seminal vesicle to form the ejaculatory duct. Ejaculatory duct merges with the urethra to form the prostate gland. Prostate gland becomes the membranous urethra, and the membranous urethra becomes the spongy urethra, and that eventually allows the sperm to be excreted from the body or ejaculated from the body. Now looking at the penis, which is the external genitalia or part of the external genitalia, it is the main organ that is delivering the sperm and, or more specifically, semen to the female reproductive system. The skin that is wrapped, skin and connective tissue that is wrapped around the testes is referred to as the scrotum. And if you combine the scrotum and penis together, that will form your external genitalia for male. You have the enlarged aspect or tip of the penis, which is referred to as the glans penis. And the other key factor I want you guys to know is the erectile tissue associated with penis. So you can see a cross-section of the genitalia here. Anything you see and depicted in blue is the erectile tissue. So you notice there are 3 separate erectile tissue. The 2 that are located right here, these 2 are combined together called corpora cavernosa. If I was talking about only one of them, it would be corpus cavernosum. But because there's 2 main bodies with their own blood vessels, and these are located in the posterior aspect of the penis, they're called corpora cavernosa. The smaller one that is located on the anterior aspect of the penis is referred to as the corpus spongiosum. Now notice right at the center of it, you have an opening, and that opening is the urethra. So if you're looking at the length of the penis and this opening right at the center, that's the urethra. You have the erectile tissue, which is immediately next to the urethra. That would be your corpus spongiosum. And the thicker one that you see on the side, which is basically showing the posterior, those would be the corpus or corpora cavernosa. Now remember, the urethra, the last part of the urethra, has the name either a spongy or penile urethra. So penile is basically because it passes through the penis, but the word spongy is because the connective tissue that's wrapped around is called corpus spongiosum, hence the word spongy. So you can also call that urethra a spongy urethra. Another component that we have is the scrotum, as I mentioned earlier. Again, this is the surrounding skin around the testes. An important role of the scrotum is it places or positions the male reproductive organs about a little bit farther away from the body, making sure that the environment is typically about 3 degrees cooler than your typical body temperature of about 37 degrees. This cool temperature is required for the production of the sperm. Wrapped around so if you remove the scrotum, wrapped around the testes, you have a muscle called cremaster muscles. And these muscles are essential for basically moving the testes as they contract, moving the testes closer to the body. So basically you have the scrotum. If you remove the scrotum, you have the cremaster muscles, and then underneath that you have the testes. Now, keeping in mind that the environment for the proper development and production of the sperm is about 3 degrees cooler, if a male has a lower sperm count, what they recommend for him is to avoid hot bath, sauna, and avoid wearing tight clothing or pants, because again, any of those can increase the temperature of the testes by either placing the body in a hot environment or bringing the scrotum closer to the body and increasing the temperature. So in these scenarios, the sperm count goes down. So by avoiding wearing clothing that are tight or avoiding hot bath or saunas, it can help increase the number of the sperm being produced. Another component we have is a spermatic cord. So if you recall, the vas deferens was the tube that takes the sperm away from the epididymis and out around the bladder, and again, continue to the ejaculatory duct and the urethra. So please do note that the spermatic cord also have close or wrapped with the vas deferens or ductus deferens. You have arteries and veins and nerves that are supplying the testes and the epididymis. So as a whole, when you bundle these together, that will form what we identify as the spermatic cord. And you can see it in this picture again. It is the blood vessels, the nerves, branches of the cremaster muscles, as well as the vas deferens. Now, within the pelvic area, we have an opening called the inguinal canal. This is a canal, again, located in the front of the body, which is where the spermatic cord basically gain access into the internal cavity of the male system or male abdominal cavity. So sometimes what happens is that part of the intestine can actually move into this inguinal canal and gets stuck in there basically. Now, this is the reason it happens is because this is identified as a weak point within the membrane, and therefore, again, certain components can pass through if there is significant amount of pressure. Interesting fact, if somebody has an inguinal hernia, the procedure to treat the condition is very simple. It is an outpatient surgery typically, where they make a small incision within the pelvic region and basically push the intestines back into play. And that's about it. These individuals probably should avoid lifting up heavy objects, which typically triggers the inguinal hernias, or they should use belts that basically secures the inguinal canal and prevents, in many cases, prevents the intestine from looping through the inguinal canal. The accessory organs of the male, we mentioned earlier, there are about 3 of them. And the understanding you should have before we go into deep about them is the fact that what we identify as semen during ejaculation is actually only 10% sperm, and the rest of that is the fluid that gets released from 2 of the 3 accessory glands. So, what are these accessory glands? Again, kind of reminding you of what we already discussed. Seminal vesicle that sits behind the bladder, prostate gland that is inferior to the bladder, and the bulbourethral gland, which is inferior to the prostate gland. So what is the job of each of these structures? Seminal vesicle is a pair of glands that are located again behind the bladder or posterior to the bladder. They are joining with the vas deferens to form the prostate, so to form the ejaculatory duct. And this is what they do. They first provide 60% of the what we consider as semen during ejaculation. This 60% include fructose, which is basically a form of sugar that acts as nutrients and food for the sperm. It also releases material that enhances the fertilization of the oocyte in the female reproductive system. So, seminal vesicle contributes significantly to what we identified as semen at 2 levels. One, basically providing nutrients for the sperm, and second is enhancing the chance of fertilization. Prostate gland, which is located inferior to the bladder, contributes about 25 to 30% of the fluid we identify as semen. And what that is basically, what is the function of it, is that enhances the sperm motility in the female reproductive system. So when the sperm is ejaculated in the female reproductive system, originally it thickens, and then after a few minutes, it starts to liquefy. And that change from basically a thick viscous fluid to a more liquid semen allows the sperm to easily swim to the female reproductive system to reach their destination for the purpose of egg fertilization. This is something we discussed before. Enlarged prostate is basically when you have the prostate as male ages, typically anybody above the age of 50 will have, or what I should say, about 50% of the population above the age of 50 will have enlarged prostates, which is what we're depicting here compared to the normal prostate gland. You can see that it makes it very difficult for the urine to come out of the urethra as it holds or tightens the passage, tightens the urethra. So in this case, many males have had difficulty emptying their bladder, and they need basically to visit the restroom multiple times to be able to accomplish the task. We also mentioned previously that because of the proximity of the prostate gland to the urinary bladder, males are more susceptible to bladder cancer. Basically, abnormal cells from the prostate can expand, find an easy way to the bladder and causing the cancer cells to metastasize within the bladder as well. Last accessory gland we have is bulbourethral gland. Bulbourethral gland is located inferior to the prostate gland. It is relatively small, it's about a pea size. The purpose of the bulbourethral gland is to make sure the environment the sperm is going to take through the urethra is properly suited for the sperm. Do understand that urethra used for both the reproductive and urinary system. Therefore, because a sperm requires an alkaline environment, but as we learn, urine is acidic, typically about a pH of 6, what you want to do before ejaculation is to clean the urethra from the acidic environment of urine. So bulbourethral gland releases this solution that cleanses the urethra and enhances the pH for the fertilization of the egg or oocyte eventually. So this is what typically gets released again, a fluid that gets released right prior to the ejaculation. Okay, we're gonna stop here and we'll pick up the female reproductive system in our next lecture.